Okay, great. So once again, welcome and thank you for joining us for the last session of the Well Prepared program, um, which is a collaboration between the Ada Pi chapter of the Make Yourself Fine fraternity, the Chi Ada Phi sorority Tau Chi chapter, the New Jersey Integrated Black Nurses Association, and the East Orange Family Success Center. My name is Barry Devon, and I am the bossless of Ada Pi chapter. And this program was designed to target families with children in grades 3 to 6, as well as their parents. It's really focusing on encouraging families to engage in a healthy lifestyle as well as developing healthy eating habits. Um, we've had some great sessions facilitated by a phenomenal group of healthcare professionals. I wanted to say especially thank you to the presenters by the Chi Phi sorority as well as the New Jersey Black Nurses Integrated Association, because you guys have done an outstanding job in facilitating these sessions. Our last session, we had a certified trainer engage us in some exercise. So we got some physical activity engaged in there as well. But the whole focus of this program is designed around a 5210 format, where we're encouraging 5 or more servings of fruits and vegetables, no more than 2 hours of television or screen time, 1 or more hours of physical activity. And today we'll be talking about our zero sweetened beverages. So we have the pleasure of having one of our former presenters join us, and I'm looking forward to her presentation. So at this point, I just want to, just a couple of housekeeping things I want to bring to your attention. Um, as part of this initiative, there was a pre and a post test that we're asking you to do so we can assess, any things that were some of the takeaways you got. So I'll put a link inside the chat today, and please fill that information out. You'll also get an email from Brother Mike Wilson, who will be sending out the link if you get an opportunity to fill out the post survey. But that really helps us identify um, if there were any takeaways, as well as what do we want to do with this program moving forward. As we state, this is the last of this session, but we're going to be planning over the summer, and we're really looking forward to bringing this program back in the fall. It may be in a little different format. It'll be in hybrid. We're going to have some Zoom meetings, but we do have an opportunity to meet in person, depending upon how things are looking in regards to COVID. But we do have the Omega Family Resource and Learning Center, which is located at 132 South Harrison Street in East Orange. So we're looking to do some programming there. For example, the physical fitness. We'll have a certified physical trainer there, engaging in some activities. We'll have some exercise activities. We're looking to have some healthy cooking demonstrations as well, because we do have a commercial kitchen located in that facility. Okay, so without any further ado, I'm going to turn it over to Ms. Yolanda Jackson, who will be the moderator for today's session. Yolanda?
Yes, good morning, everyone. We made it to the
Morning.
home stretch. Yes, this is the last one for this season. As always, I thank you, parents, for hanging in there with us. And the children, I'm just going to miss them all over the summer. But I hope that this program has enlightened you to change some of the habits that you may have had, and maybe encourage some others to do the same. As we know, health promotion is the key to disease prevention. And with that being said, I am not going to prolong your time. It is already 10 minutes after 10. We have a phenomenal speaker, my sister, my soror, Akia Blandon, Dr. Akia Blandon, who is going to speak to you today about zero sweetened beverages. Please feel free to add any questions, comments in the chat during her presentation. We will attempt to address all questions. And I'm turning it over to you, Soror Akia.
Good morning, good morning, good morning. It is a privilege and an honor to be with you all again today, talking about something very near and dear to my heart, No sugary drinks. So Barry, can you please share the slides?
Yes.
As he's sharing just a little bit about me, I'm Dr. Akia Blandon. I am a doctor of nursing practice. I'm a nurse practitioner by profession, which means that I provide primary and urgent care services to individuals in the community. Why are sugary beverages and health and wellness so important to me? Because I live it. I live it every single day. Many years ago, I was diagnosed as diabetic. There's a test called the hemoglobin A1C, and that test is used to measure and to diagnose diabetes. And my hemoglobin A1C, which should be below 5.7, was 6.7. And at that time, my doctor said to me, okay, we're going to need to put you on some medication. You see, I come from a long line of individuals who suffer with what you may know as sugar diabetes, but what I know is diabetes. My mother's diabetic, my sister's diabetic, my grandmother was diabetic, my aunts are diabetic, my uncles are diabetic. Wow. All diabetic. My dad is diabetic. All individuals who had this disease that at that point in my life, I was facing for myself. And I'm a little stubborn. If you know me, I'm a little stubborn, a little hard-headed. And in that moment, I said to my doctor, give me a minute, give me a chance to try to fix this. Because at that point, I understood that what I put in my body mattered to my body. And so I went on this whole trek to change my life and to change my health. And that included eliminating sugary beverages. And I don't know about you, but if you grew up in New York City, a pineapple soda or a grape Welch's soda will hit the spot. A Pepsi hit the spot. So I had to put all of that down because my day wasn't complete without a Pepsi. And I decided personally to put that down. And I'm happy to report today, I just had a physical last week, and that same A1C was 5.4, not even in the range of diabetes. And so I share that story to let you know I'm not just talking to you about some things on the screen. I live this thing every single day. And small changes that you can make in your life and make in your children's life can impact. Go ahead, Brother Barry.
Oops.
Okay, so sweetened beverages.
Hold on for 1 second. I missed a slide. Give me a second. This is, let's see if we can do it this way.
It's sweetened beverages. It's okay. It's just says sweetened beverages.
There it goes.
So what are sweetened beverages? Sweetened beverages are beverages that have added sugars or anything that it didn't originate with, right? So anything, if you look at the label and the end of the label says OSE, that is considered a sweetened beverage. A sweetened beverage is anything other than water, essentially, that doesn't have, that has added sugars placed in. Next. So why is it important to understand what sweetened beverages are and to talk about them? Well, it's important because in nowadays times, when you're taking a beverage that has been sweetened in, it gives you a lot of extra sugar and a lot of extra calories. And calories are units of energy. Now, one might think that if something gives me calories, that's a good thing. But those calories are empty. Those calories don't provide you with the nutrition that your body needs to function and to move and to do all of the bodily functions that it's required. So avoiding those sweetened drinks in lieu of nutrient-dense calories like fruits and vegetables and the like is very important. So how do you know that you're drinking a sweetened beverage? Well, I indicated a second ago that the label matters. The labels matter. Oftentimes when we go into the grocery store, if you're anything like me, you don't have much time to stop and read the label. Anybody busy and just go in, you know what you need to get, you're just getting it, so you got to move. I want to encourage you to allot a little bit more time, because when you stop and read that label, you'd be amazed at what is in the things that we are putting in our bodies. And I have a general rule for my patients. If you can't pronounce it, don't eat it. If you can't say it, don't drink it. And so when you're looking at these labels, you want to look to see if they have added sugar, if sugar is one of the top 3 ingredients, if honey is one of the top 3 ingredients, or any sort of syrup. And those syrups can be anything like corn syrup, brown rice syrup. They could end in the word OSE, as I indicated, glucose, dextrose, sucralose, right? Those are all added sugars. And so when you're thinking about them, sometimes sugars are naturally occurring and artificial. And some may think that the artificials are the better sugars. Well, I want to throw a little monkey wrench in your thinking. Just because it says no calorie and it's an artificial sugar, don't mean it's good for your body. There are lots of studies that speak about how that artificial sugar is doing, what that artificial sugar is doing in your body, and how it's causing the natural processes that need to occur in your body for it to be healthy to be impacted. So I want you to steer away from those too. I bet you're wondering, well, if I can't have a sugary drink, well, what can I have? Well, calcium matters. And so non-fat or 1% milk is a good alternative. Anything that's 100% juice is a good alternative if you need to drink your juice. You can next slide. But when you're drinking those juices, I want to encourage you that eating the fruit and the vegetable is far more important. But if you must have juice, if your time allots for you to have that juice, steer towards the 100% juice or the naturally occurring sugars. So how does it impact you? How does it impact your life? And how does it impact your child's life? I started off this talk talking about diabetes and how it impacted me and how it impacts my family. Sugary drinks are tied extremely closely to type 2 diabetes. Type 2 diabetes is the what I like to call the environmental or the conditional or the physical type of diabetes. You see, when we are overweight, when we are sedentary, when we are eating fatty, non-healthy, sugar-laden foods, fruits and desserts, when we're drinking sugary beverages, we predispose ourselves to diabetes. Genetics, somebody might say. I made sure I told you about my mom, my grandmother, my father, my sister, my cousin, and all of those people, right? Genetics are naturally occurring. If it's in your family, there's a likelihood that it could happen to you. But I'm gonna stick a pin in that too. Genetics are naturally occurring, but your lifestyle teaches your genetics how to act. So if you cut out those sugary beverages, if you cut out those sugary foods, you can teach your genes to re-express and behave in the way that they should because they're not being bombarded. Tooth decay, that's self-explanatory. Tooth decay, sugary drinks, they sit on our gums and they decay our teeth. Cavities. When I was growing up, we used to go to the dentist. And when we would go to the dentist, it was a big deal when the dentist told your mother you didn't have a cavity. I don't know about any of you who may be in my, age range, who not having a cavity was a big deal, right? But when you think about what you drank a lot, we drank from the hydrant. I don't know about, I'm a New Yorker. You got thirsty, you drank from the hydrant. And some of my suburban people, you might have been out in the hose because when you were out there getting dirty, your mother didn't want you inside the house. So our drink of choice was water. And I want to encourage that to be your drink of choice. I told you that sugary beverages have empty calories and they have no real nutritional value. So putting that stuff in your body takes your calories over the roof, but it didn't do anything for your body and for your health. And then the other things is reducing bone health, increasing anxiety. The way that sugar works in the brain is much like a drug. It is addictive. It is not, I am not pretending this, I'm not guessing this. There have been many studies to show Sugar it exhibits a hormone very much like that of cocaine. And your body actually craves it. And when you crave it, you want more of it. And if you can't get it, your body has a physical reaction to not having that sugar. So taking that down helps to decrease the anxiety. And of course, poor sleep quality. If you have this feel-good hormone being excreted because of the volume of sugar that you've taken in, well, of course, sleeping is not going to be on the top. Good sleep is not going to be on the top of the list. Next slide. So essentially, what am I saying? I'm saying to ensure that you avoid sugary drinks. I want to tell you a little bit about some common drinks that we drink nowadays. Snapple. Anybody ever have any Snapple? Okay. The human body, women should have about 6 teaspoons of sugar a day. Men should have about 9. So these next beverages I'm going to share with you supersedes that. Snapple, a regular Snapple, has 17 teaspoons in a bottle of Snapple of sugar. Minute Maid, anybody drink those Minute Maid drinks? They have about 31 cubes of sugar, 31 teaspoons of sugar. How about those naked drinks? They're healthy. Those are vegetable naked drinks, right? They're very healthy. Not. They have 23 teaspoons of sugar in a bottle. Well, vitamin water, because she said drink water. Water is good. Vitamin water is really good. No, 12 teaspoons of sugar. Oh, Akia, you don't understand. I'm so tired. I got to have a Red Bull. The job that I do requires that I have a Red Bull, and I need a Red Bull a day, but it's only one Red Bull a day. Well, that's about 23 teaspoons of sugar in one Red Bull. Anybody like those Starbucks drinks? Those Starbucks drinks, you know, in the bottle? Those are about 20 teaspoons of sugar. Gatorade, my sports people, we give it to the kids on the field. Those are about 23 teaspoons of sugar. Arizona iced tea in the can, 22 teaspoons of sugar. Mountain Dew, 19 teaspoons of sugar. I could go on and on and on, but I think you get the picture. What doesn't have any teaspoons of sugar? Water. What does your body need for every process it has? It does. Water. What is your body largely made of? Water. And water hydrates. Water helps to clear your skin. Water helps to allow your body to function and pass bowel movements regularly. Water is the drink of choice. We're going to avoid sweetened beverages. Next slide. So I told you earlier that it's important that if you must drink a juice, that you look for 100% juice, that you don't drink anything that says drink or beverage or cocktail on the labels, because drink or beverage or cocktails are not 100% juice, but that you look for the label so that it ensures you are drinking 100% juice or vegetable juice. Fruits are better though. Eating an apple is far better than drinking the apple juice. Why? Because you get the fiber from the apple. Your body can break down, and your body needs fiber in order to function. So it's important that when you are choosing to drink, and believe it or not, if you sit down and eat a bowl of watermelon, you feel more hydrated. Anybody like watermelon? Get you some seeded watermelon and sit down on a hot day, and it refreshes you far more than you drinking a watermelon juice. And I'd be afraid to drink watermelon juice because I don't really know if that would be real. But eating the natural fruit is far better than drinking the juice. But if you must drink the juice, remember I said to drink 100% juice. Next slide. So I said to you that Gatorade, what we use every single day, and Red Bull, they have all of this sugar in it. these can potentially have health risk. They can have risk to the heart. They can have risk to the stomach. They disrupt the natural microbiome or the natural function of what's happening in your stomach. You see, in your stomach, you have all of the bacteria you need and things you need to break down the foods and the nutrients that we take in. And when we put these artificial sports and energy drinks into our body, they have negative effects on our body. Additionally, they shoot us up and they drop us down really hard. I'll be the first one to tell you that I've drank a Red Bull before. You know, when I do a marathon drive, I'll throw a Red Bull back. And when that crash comes, though, that Red Bull drops off, it's actually dangerous. You can barely keep yourself together. And so it's important that that you avoid these types of drinks because of the negative impact that they have. Now, if you are a long distance runner, or if you are an endurance type of an athlete, these types of drink may not be as poorly recommended for you. But on a regular, let's avoid them. Let's drink some regular water. If there's an electrolyte issue, let's get some of a little bit of salt in the water, right? Sodium is one of the electrolytes that are in it. Let's get a little bit of that in the water, like a quarter teaspoon, to try to hydrate yourself and kind of balance those electrolytes. But please, let's avoid sports drinks, sports and energy drinks. Next slide. So on your screen, you can see a comparison between sports drinks and energy drinks. And so sports drinks, those are drinks that typically help athletes like Powerade and Gatorade. And again, they're recommended only for those who are doing endurance type of events. Energy drinks are those things like 5 Hour Energy, Red Bull, those double shots, those types of things. And they may give you a little bit of clarity, but they are going to cause you to crash. And these should never be given to children because they contain stimulants and flavorings and colorings that have been linked to all sorts of other issues. And those same energy drinks, I told you, impacts your heart and your blood pressure. And then they lead to all sorts of ancillary issues like inability to concentrate, difficulty sleeping, anxiety, behavioral issues in children. So please always avoid them in children. And if you must use them with yourself, please only use them sparingly. With regard to sports and energy drinks, it's important that you understand that you take in that which your body needs, that you take in everything that your body needs naturally so that you don't have to replenish using these things. Because guess what? Most of us are on a quest to lose a pound or two. Even after losing over 80 pounds myself, I still have some more that I'd like to take off. These types of drinks with these added sugars and these added ingredients act very interestingly in our body and can contribute to weight gain. Next slide. So what should you drink? Water. Water is what you need. I said that it helps you to do everything from produce tears to have a bowel movement. Water helps you to have energy and be strong and be physically active and stay hydrated. Water does not cause us to gain weight. In fact, it helps us to lose weight by flushing toxins, right? As we urinate and as we go to the bathroom, right? Our body flushes the toxin that may want to stay in our body and hold on to excess weight. So drinking water helps to move the process. Children may not always like water. And so I shared in a previous talk that you can put some fruit into the water. You can make a nice, fun drink for children to drink. And if you make things colorful, children will often migrate to it. And so I have a 3-year-old goddaughter, and she and I like to make water. And when I say make water, we take some regular spring water and we slice up some oranges, or she pounds down some strawberries or blackberries, and we put them in her water bottle. because you know she has to have her water bottle because godmommy has her water bottle. And so we muddle those fruits and vegetables, and those fruits, and we put them in. And you can use vegetables. Cucumber and mint is an amazing combination for infused water. But we muddle those and we put some water in it, and it turns the water into a pretty purple or pink color, or red color, depending on how much of which you have. And that 3-year-old takes that water back like she's drinking juice. So make it fun. Use lemon slices and make your own combinations and do it with your children so that they feel involved and engaged in the process, and they're more inclined to drink and eat that which they created. Next slide. So I shared with you earlier some common drink choices. And the way that I explained it to you was this last column, the teaspoons of sugar, right? Take a look for a second at all of these common drinks that we have, that I shared with you, have X amount of sugar in them. And way down at the very bottom, you got little old water with 0 calories, 0 grams of sugar, and 0 teaspoons of sugar. Water is the beverage of choice. Next slide. I think that's the last slide.
Yeah.
And so I would like to open up the floor if there are any questions for me. It was a very quick talk. I hope that you walked away with information that you will use going forward in the future regarding your intake of sugary beverages. The next time you go to reach for that sugary beverage, I hope you think of this face and say, wait, let me get some water. That's what I hope that you do. Let's avoid sugary beverages together.
Hi, I'm Denise speaking. I personally use Polar seltzer water myself just to mix it up a little bit, and not to throw out a supermarket, but there is one that sells it at a really good price. And I just recently tried a toasted coconut by Polar Seltzer. It is amazing. So I purchased like 5 bottles of it. And the young guy checking me out says, "You really like this, huh?" I said, "Yes." So it helps to mix it up a little bit. And I agree with you with the cucumber and mint. It is awesome.
I agree. I failed to mention, I'm a seltzer girl too. And I became a seltzer girl because I was previously a ginger ale girl. And so I needed that fizz. New Yorker, sorry. I needed that fizz, right? And so the seltzer water gives me that with no calories, no sugar. It's important to read the back. Polar is a good brand, not plugging anybody's brand and not paying us. But Polar is a good brand. It's important that with seltzer water too, you read the label, because sometimes they try to sneak some stuff in and they'll call it a seltzer water, but it's really not. It's a sparkling drink. A big box store that has a blue label on it. They sell these things called seltzer, and it's fruity, kiwi this, and it's really sweet. And seltzer is not sweet. When you look at the label, it has a whole bunch of stuff in it that you don't want. So seltzer water is absolutely an amazing substitute when you want to mix it up. I agree. Thank you, Denise.
That's good to hear regarding seltzer, because that's what I've been primarily drinking the last couple of months. So it was a debate whether regular or seltzer, which was better. I was like, I'm not drinking soda, so you got to give me a break. I'm at least drinking seltzer water. I need that fizz,
Right.
So here's a tip for you. Soda Stream. Have you ever heard of a Soda Stream?
Mm-hmm. Mm-hmm.
Soda Stream I have in my kitchen. And I take regular water and I fizz it. And I get my fizz. And I'll throw some lemon in it. I'll drop some lemon in it. And I got my lemon lime seltzer for no money. So again, just when you make it or you do it, you know what's in it. So seltzer, I'm glad you're not drinking soda, Barry. I still want you to drink some water though. Regular water.
I'm working on it. 5210, absolutely. I'm on it. I'm on it.
I try to start the day before I leave my home, at least to get 16 ounces of water in.
Absolutely.
Lisa knows when you know too, Dr. Blandon, in the healthcare environment, sometimes we can't stop to hydrate ourselves during the day. So at least before I leave the home, I get it.
So that's a great point. I'm sorry, Barry, I want to chime into this one. To everyone, the first drink that you should drink in the morning is water. Get at least a glass of water. And I'm not kidding. I do like you. I do about 16 to 20 ounces of water before I leave my house. I'm also working out fasted. That's a whole different session, a whole different presentation. But I do that. But what is water going to do to your body? It's going to wake it up. It's going to charge your digestive system to get moving. It's going to tell your digestive system, we're up, start working, start getting rid of that which has sat in it all night without being too graphic. So water, absolutely, in the morning, first drink, have it by your bedside. I agree 100%, Denise.
You have a question about kombucha inside of the chat.
Is that kombucha? Kombucha?
Yes, yes.
So kombucha is very kombucha is really good, actually. It's a good drink for digestive health. It has great probiotics and prebiotics in it that helps your body do what it's supposed to get rid of what it's supposed to. But you need to get a reputable brand. Kombucha needs to have that slurry stuff in it. You know, these, I've seen kombucha. I saw your face, Lisa. Kombucha, I've seen these pretty brands of kombucha that are just clear and wonderful. You know, that's fake. You want to go to a health food store like Whole Foods or your local health food store. Kombucha is expensive. It might be about $5 for a 20-ounce bottle. So if that is what you want, you can definitely do that. But you can make your own sort of probiotic, prebiotic drinks at home with apple cider vinegar. You can go to a healthcare store and get a bottle of apple cider vinegar with the mother. Yeah. Make sure it has the mother in it, right, with the mother, and you can make a drink with a few. If you're interested, put your email in and I can share that with you, my own personal recipe. But you can muddle some berries, right? Because apple cider vinegar, you should never throw it back. You should never take a shot of apple cider vinegar. It will destroy your teeth. Don't do it. I know you see people do it. Don't do it. They're wrong. You can put a couple tablespoons, 2 tablespoons, muddled berries in it and fill it with water and drink that back. It is refreshing. It's hydrating. And guess what? It's going to help your gut health. And it's cheaper than kombucha. So kombucha is good. It's just pricey and it's not always in everybody's reach, and it needs to have that slurry in it. And if you have a texture thing, you can't really do that slurry slime thing. It just doesn't work for you.
And I add a little bit of cinnamon to that as well. And that is just phenomenal. So yeah,
cinnamon is amazing. It's an anti-inflammatory. Yeah. It gives a nice flavor. It makes you think you're drinking something exotic. It all works. It tricks the brain.
Right. So you have another question, Akia. Is alkaline water a better water to drink?
Right here next to me is Evermore alkaline water, 8.8 to 9.1. Is alkaline water better to drink? There's lots of discussion, and I think the camps are fully divided. I'm a water snob, and I love the taste of Evermore. I love how it tastes. It's refreshing. There's no aftertaste, but I'm not a Fiji girl, right? I feel like Fiji has an aftertaste that doesn't work for me. Alkaline water is a great water to drink because studies show that diseases thrive in an acidic environment. So any way we can try to make our bodies alkaline, it's a good thing. But at home, as you know, everybody can't afford to go and spend $4 on a bottle of water. So slice those lemons and put them in regular water and drink that. Guess what? You've alkalined that water.
Right.
I hope some of this helps.
And it does.
Go ahead.
Well, here in Phoenix, you know, we're always having to drink water because if not, then you're going to get overly dehydrated easy because of the dry heat. You're not really understanding that being outside without your water first thing in the morning and all day long, if not, then you can pass out just walking from trying to get into your vehicle with this intense heat. So water is necessary, especially in heats like we get here.
Absolutely, absolutely. And some people, to my ladies or men who may not sweat so much, you may believe that maybe you're not dehydrating. Just the point you are. We eliminate fluids via breathing, right? Just our very breathing, we're eliminating fluids in our body. So being hydrated is very important. So yes, if you see those temperatures go north of 80, don't leave your house without a bottle of water. Don't you do it. Don't be caught in the middle. Learn on your route where the clean bathrooms are. I'm a snob too. I don't really want to use all of, I drive from the Bronx to Pennsylvania every single day, and I know where I can stop and where I can't. So I keep my water with me so that I stay hydrated. And your skin, water for your skin is absolutely amazing. It helps to keep your clear skin, acne. If our young people are fighting acne, water is just a great thing.
That is true.
I just want to share with everyone what I do, and I've been doing for a long time. I do the infused water. I slice lemons and limes, and I do that. I've been doing that for years. On hot days like this, I freeze water and take it out and in a bottle of water. And when you're going about your errands, that water is melting and it's perfect. And you have your natural ice in there because it was frozen. In the mornings, I drink hot water with fresh lemon in it. And that's how I start my day. I've been doing that for years. There's some other habits I'd like to change, but the water, my water game is on fleek. I have to say that I've been really doing a good job with infused water and trying different things like, Dr. Akia said, the cucumbers. I do various different infusions.
Yeah. Strawberry.
Yeah, I've never been a fizz person, but recently Yolanda had a family event and she was giving out, it was salsa water, and I think the brand was Poland, and it was my first time having a fizz drink. And again, I'm not a fizz person, but it was refreshing, I would have to say. But I'm still a non-fizz person. But anyway, I just wanted to share what I do for hydration. Thank you.
That's awesome. Hydration matters. And when you think about how much water you should drink, this is always controversial. I know we all learned 8 glasses of water. I want to challenge us to get past that. Think of your body weight divided by 2 and drink half your body weight in ounces per day of water.
So that's a great discussion from everyone. Anyone has any other questions or any topic they'd like to bring up pertaining to 5210, being that this is our last day?
How about coffee?
So I am a coffee girl.
Okay.
Mr. Jackson, I'm a coffee girl. I have to have, and I'm a coffee snob. I don't like acidic coffee. Coffee has to be good coffee. I have an espresso machine in my office, and I'm a coffee girl. So yes, you can have coffee, right, in moderation. If you're drinking, right, caffeine is a stimulant. So if you shouldn't have coffee after 2 p.m., right? You should not. You should try not, because that's going to impact your sleep. But if you're drinking a cup of coffee, max 2 cups of coffee a day, and that is outside of your water and your hydration, feel free. Because guess what? Coffee is going to actually dehydrate you. Coffee is going to cause you to urinate. Coffee is going to cause you to causes some people to have a bowel movement. So you need to have your water on top of what you drink for coffee. So go ahead on, Mr. Jackson, and have some coffee, but have some water too.
Coffee does not affect my sleep at all. I have coffee at 3 a.m. and be asleep by 3:30.
Wow.
I don't have problems with sleep. When I'm tired, I sleep.
Okay.
Now, what I have learned, and I have to admit, my wife suggested it, that I used, because I like to, make smoothies with vegetables with fruit and whatnot. But I started using kombucha, or whatever they call it, as the liquid, and it was excellent. I mean, because you talk about aftertaste. See, that's when I know something is not right. If I have an aftertaste, then I said, oh, it's not natural. Something's not natural. I try to listen to my body. I've lived a long time, and it's taken good care of me, even though I don't always do the right thing. But, you know, moderation and balance and all of that is important. But no, this has been excellent. I learned a great deal because that sugar can be a problem. I know. And oftentimes our families suffer from, you know, elements of diabetes. And even though my parents, for example, they lived beyond 95 years old. So I don't know if I'm going to make it, but you know, but they all both had elements, but they managed it well. They never had to take anything, medication, but my mother was a stickler, and you know, it's paid off. It's paid off for me too, because, you know, sometimes I see her face when I something I'm not supposed to do.
Trying to cheat.
I love it. I love it.
And let
Thank
me,
you for that.
hi, Kim. This is Cheryl. I just want to chime in about the coffee. Coffee causes fibrocystic breast in men and women. So you need to really drink decaffeinated coffee, because then, especially for women, when you have to go have a mammo, it'll say you have microcalcification. And so if you can, you should really try to drink decaffeinated.
Can't do it. Can't do it. Not gonna happen. Can't stand it.
Hold on,
But they do
I'm with Brother Jackson on that one. I need to have my caffeine.
Me
Get my
too.
kickstart. And also, actually, when I drink the coffee, it doesn't affect my sleep, because I could drink coffee, and it's like I said, most of the time in the morning, I need that to get started. That's after my water though. And like you said, it does, because of the caffeine, is going to cause you to dehydrate, but that also encourages me to drink more water throughout the day. But no, it doesn't affect my sleep. I could drink coffee and go right to sleep if I'm tired. So,
and we're talking about coffee, but then what if the person is a tea drinker? It's the same.
Can't do it.
Well, I'm just saying, because, you know, those individuals who love coffee are fine, and it's caffeinated, and tea.
Yeah,
So you have to be careful in terms of the
Yeah.
them being
I'm
caffeinated,
the decaf.
and so it is an issue. And Dr. Blandon, often people say a cup, and I was talking with a patient's wife just yesterday, and
Size
we're
cup.
talking about water, and the doctor said 8 cups of water a day. I said, but did the doctor define cups to you?
Right, that's true.
It's critical. What is it? 8 ounces? Is it 12 ounces? Is it a mug? So, Mr. Jackson, when you're speaking of the cup of coffee, you have to think of how much are you drinking.
Thank you.
Great. And to Cheryl's point, I just want to tie back to Cheryl's point. Your own individual health journey will determine what you can put in your body. And so if you are someone who suffers with fibrocystic breast disease, then you should not be having the coffee, right? I think ultimately each of us, you know, if you're allergic to a thing, you're not going to eat a thing. If it's causing a negative reaction in you, you're not going to take that. So that's important for you to keep in mind. So to Cheryl's point, yes, if that is your condition, most assuredly, you know, avoid it. But Cheryl, I need my coffee. Sorry.
Greetings, everyone. This is Olin. Just want to add the pharmacological aspects of it. For those of you who say maybe coffee don't affect you as much, it's just like most drugs, you build a tolerance. And for different people, it affects differently because your pharmacokinetic aspect. Some of our enzymes are more prone to breaking it down quicker than others.
Thank you.
Agreed.
if I'll just interject here, if you don't mind, Yolanda. I put inside the chat, I put a link to a survey. I mentioned this at the top of the meeting. As a way of us assessing any takeaways, any of our parents and students who have joined us have gotten from the program, please fill out that form. It's just a couple of questions. We really want to get a good assessment on how we can improve upon the program moving forward. As well as, although this is the last session, we're looking to move this program forward into the fall. So it may be a hybrid, or I'm sure it will be a hybrid format where we'll have some Zoom meetings and then we'll have some sessions in person at the Omega Family Resource and Learning Center, which is located at 132 South Harrison Street in East Orange, New Jersey. If you recall, during our last session, we had a certified trainer there. We did some physical exercise. So we'll be doing things like that during the next phase of the program. We're looking to do some healthy cooking demonstrations, and definitely looking forward to working with our wonderful healthcare professionals and delivering the content to you the way they did during this current session.